Previously on The Real World.
Ashley, what are you doing?
What do you mean, what am I doing?
What are you doing?
I'm taking her blood pressure.
You don't put that on her neck.
Yeah, Miss Wampler said we can put it on the neck.
This is the true story of 5 strangers
Picked to clean teeth.
And have their lives taped.
To find out what happens when people stop being polite.
And start getting real.
The Real World Dental Hygiene.
Crushing pain. I think I'm gonna be sick.
It's gonna be okay, Miss Hart. Sarah, go get Dr. T-Rex and tell him we have an emergency and bring back the emergency cart. Jessica, go have Miss Hickman call EMS and bring back the oxygen tank. I'm gonna go ahead and take your vitals, okay? Just relax. Just leave your arm. Everything's gonna be okay, Miss Hart.
We think Mrs. Hart is having an MI. Can you contact EMS?
Certainly.
What's going on?
This is Miss Hart. She's 55 years old. I was cleaning her teeth and she started complaining of a crushing sensation in her chest. She also showed the Levine, so I sat her up and now she's saying she's nauseous.
Okay. Does she have history of angina?
No, she doesn't, doctor.
Has EMS been called?
Yes, they have.
Okay. Relax, Mrs. Hart. I'm Dr. T-Rex. I'm gonna be here to help you, okay? Just try to relax. Lean your head back. Miss Sarah's gonna put some oxygen on you. What's her vital signs?
Before procedure, her vital signs were stable. I just took them and her blood pressure was 140 over 110. Her pulse was 115 and irregular, and her respirations were 40 and very shallow.
Try to relax, Mrs. Hart. Breathe in and out. Slowly in and out through your nose. I'm gonna give you a little pill underneath your tongue, okay? This should probably help with some of the pain. Just open up for me. I'm just gonna put this little pill underneath your tongue. Relax down on it. Breathe in and out through your nose. Try to relax. It'll tingle underneath your tongue. More oxygen, please. Try to relax. Stay calm. She's lost consciousness. We need to get her on the floor. Let's start CPR.
Oh, is it on? Hi, I'm Miss Hartz, and I'm alive and well because of the dental staff here. They wanted me to talk about my signs and symptoms, things I was experiencing while I was going through my myocardial infarction. And some of the symptoms I was having, I was feeling very weak and dizzy, and I was nauseated. I was sick to my stomach. And then all of a sudden I had this sharp pain that came to my chest, and I had this sense of impending doom. I felt like I was going to die. The staff did tell me that once I threw my hand up like this, they called that the Levine sign or Levine sign. They knew something was wrong. And then I was sweating, and I was able to tell them that I was sick, and I had shortness of breath. I was breathing a little bit like something like that. I can't remember, but they said that with all those signs and symptoms, they knew something was wrong, and I am alive and well today because of the professional and caring staff and the fact that they work so quickly. So thank you.
I don't understand how Ashley knew that Mrs. Hart was having an MI and not just an angina.
Well, the patient was complaining of crushing pain, and then she threw up the Levine sign. And also, she was nauseated and she was sweating, which is usually associated with an MI and not angina.
Oh. Why did Dr. T-Rex give her nitroglycerin? Isn't that only for angina?
No, first of all, he knew it was okay to give her nitroglycerin because her blood pressure was 140 over 100. If she had been hypertensive, it would have been contraindicated. And also, you can give nitro for angina, and if it doesn't alleviate the pain within a few minutes, or the pain diminishes and then returns, then you know that's a myocardial infarction and not angina. And one sure way to know is over the 15-minute period where you give the 3 pills, if that did not alleviate the pain, or once again, if the pain went away and come back, that would be how you knew it was an MI.
Okay. The whole thing happened so fast. Everyone acted so quickly.
Yes, most deaths that happen from an acute MI happen within a few hours of the onset of symptoms. That's how we knew we had to act quickly.
So when do you think we'll see Mrs. Hartz again?
Well, a patient should only have emergency dental care in the first 6 months following a myocardial infarction. So I guess we'll see her again in about 6 months.
Who does Ashley think she is? You know, she is so bossy, telling you to go get this and me to go get that. She could have at least said please.
Well, it was an emergency.
We had a really good day today, despite our blood pressure issues last week. But through all the training and everything, the girls surprisingly did very good today and took care of Miss Hartz. Sarah, did you seriously just pick that up and use it in her mouth? I gotta go.
Man, today was crazy. I almost forgot what to do during the emergency, but then I remembered Miss Wampler's freshman dental office emergency class with all those quizzes and tests, and it really helped. So thank you, Miss Wampler.